very generously, and Scott is here to share with you his expertise in this technique. So we're going to take you, well, Scott is going to take you through the actual procedure, but just before we get to that, I'm just going to go through the usual issues that I go through with you so that you know what you're doing, and then you're well prepared. So we are pretty much following what's in the manual. So during the days, it was in the manual to start with. Again, we're going to be labelling these slides with pencil. We're going to make a slight variation in that in order to save reagent, we're going to put a wax, we're going to draw a wax circle around the tissue, and Scott is going to show you how to do that. The point of that is so that we can add a small amount of reagent to the tissue and it won't float away. We won't need to cover the whole slide with reagent. Okay? Because in reality, we don't go pouring, 2 or 3 mils of reagent of antibody on the tissue. Okay, these reagents are expensive and so we use them judiciously. But as I've said, make sure you label the slides, you're well aware of that, we're at the end of semester so we don't want to see any mix-ups. You will be using your Cochran jars today, and we've got them at the end of the benches. And if you're in a situation where you find that there's going to be many in your Cochran jar, please be extremely careful. Okay, we do not want students to be starting again today. Time is of the essence today, so please, if it comes to having to put several slides in one Cochran jar, take the time to make sure they are inserted carefully and that you don't put 2 slides face to face like that. You can fit quite a few in here. I know I've stressed this before, but we've had the luxury of having plenty of these in the past. So we'll see how we go today, but if you find that you're cramming slides in, please be extremely careful and seek our help. Okay, so we've got 3 slides. And although this technique of immunohistochemistry involves a stain, the staining or the detection method is via an antibody that is actually bound to an enzyme. So you're not actually going to be expecting tissues to be stained. There's an indirect staining method, as you will see as Scott goes through the technique with you. So the slides that you will have today are 3. You have one which you are going to be doing a regular hematoxylin and eosin stain on, and this is of the same tissue as the other 2. Then you will have your test slide, which is essentially you'll be trying to detect smooth muscle actin in the tissue. So we're going to detect it via an antibody called smooth muscle actin. Okay? And then you have a control slide, which is the same tissue as a negative control, and this is controlling for the IgG isotype of the antibody. That's your negative control. Okay? So these are the 3 slides you have. These are the codes. Please write the codes down. So they're all 121 300, 121 300, and then 3001. 121 3001. H for H&E, AB for your test, and ISO-C for your control. So ISO-C, ISO control, your negative control. Now, to avoid any confusion about when this track is due in, I have it up here. This is going to be due in essentially next week. Is that right? It's next week the 30th? Yes. It is. Yes, sorry. Just check. That's right. So at the end of next week. So you only have 1 week for today's web track.
No, what's it?
Okay?
This one, June.
Calm down, everybody. You have 2 weeks for last week's track and 1 week for this week's track. Okay, and Tamara's view is that you've done it enough times now, and she doesn't want students handing things in the week of the prac exam. And also you have to remember that students next door aren't doing this prac until next week. So everyone is only going to get a week to do this particular prac. Okay? So any is due in on the 30th. So the wet pack from last week and this wet pack, okay? And remember, you only need to take 1 times 40 photo. However, today we have 1 camera down next door. Sorry guys, I was just told that myself. So please be patient. Try and be orderly in the queue. I know that's really trying. But try and be patient with your fellow students. Everyone is going to want to try and take a photo if they have a chance today. Otherwise you can come in on Friday. Okay, these were from last week. Don't forget to look these up. These were stains for neural tissue. So it's a reminder for you to look them up. And usually when these reminders appear out of nowhere, they're a hint from tomorrow. Okay? Because there's no reason for her to remind you about this. This is last week's demonstration slides that she asked you to look up. So take that as a big hint. Okay? Alright, risk. Solutions with risk. So today you're going to be using diaminobenzoline. This is a suspected carcinogen. Okay? So we are actually going to be dispensing it in the food cabinet, and we want you to be wearing your PPE, so your gloves, your goggles that you have for today. I don't want anyone, coming to me and saying, "Oh, I managed to puncture the glove and I stabbed myself with DAB." Please don't do that. I mean, you won't die now. You're not likely to die, full stop. But you need to be aware that there's proper procedure in place for using these reagents. Okay? The 0.3% peroxidase we're using on the benches. Again, there is actually less risk involved in using this, but please, gloves at all times. If you have sensitive skin, please use double gloves. Okay? I have a student in my other class who has exquisitely sensitive skin, and 1 layer of glove isn't enough for xylene. She feels it immediately if it gets on the glove. Okay, mounting. I think you're all doing really well with mounting. You're not going to be doing any of this other than for your H&E, so washing of slides. You're not going to be rinsing your test slides underwater. Okay, you're going to be rinsing with a twist block of saline solution that you're going to pipette on the tissue. So this is really just referring to your H&E, which you're going to do over the sink. Okay, and you've seen all of this before, so I won't take you through it. So again, just to check, you've got 3 decarbonised slides that Ali has decarbonised for you. 1 for H&E, 1 for your test, where you're going to detect smooth muscle actin, you're going to see that's there, and 1 is your negative control. Okay, so now I will hand over to Scott, who's going to take you through the actual procedure, and feel free to ask questions. Don't interrupt me too many times, but perhaps at the end if you have some questions you can ask, and I'll just switch over to that side.
Okay, thank you guys. So what we're going to be doing today is obviously staining this smooth muscle actin. In the order to get this practical done in a timely fashion, we've actually gone and done some of these steps for you. It's important to sort of understand that this is a necessary part of it, but just, we don't have the luxury of time to be able to do that. So just to run through those steps that have already been done, we've de-waxed the slide, so those first 2 lines that you see in that grey, we've actually deparaffinised it through xylenes and graded alcohols, taken them to water. We've then gone and split these sets of slides up, so when you go over and pick up the slides over here, there's 2 containers. You'll need to take 1 slide for your H&E from the container marked H&E, you'll take 2 slides from the one marked IHC. It's important that you get that right. So what we've done is we've gone and done a technique called antigen retrieval, heat-induced etiquette retrieval, target retrieval. These are all synonyms, and I'll explain that in a little while when we're actually doing one of the incubation stages. We'll go through a little bit of that. So this process is actually designed to reverse the effects of the hormone fixation that the tissue has been exposed to. And so that technique involves using a water bath with a target retrieval solution. We've heated it up to approximately 100 degrees. The tissue has been treated, and then we've allowed it to cool down. So this is why we've gone and separated those. The tissue hasn't been prepared identically. So what you'll do is you'll go and grab your slides, write your name and the details that you're instructed on the slide, and then we'll actually be working at the ends of the bench rather than staying in your seats. It's just more to try and sort of keep all of the reagents together. So the first step that we'll need to do is that we'll actually need to write around the section with what we call a wax pen. Now this is a wax in a solvent, so it's dissolved in a compound that evaporates. So when we draw this, it just looks like a standard art line pen, and I think this one, I'll send one up here. Grab that. Okay, so it pretty much just looks like a standard art line pen, something like this. What you'll do is you'll take your slide, and you can see the tissue is marked here. You'll take the pen, and you don't actually push down on the pen, it's important, otherwise you'll just get a big doll of wax that will flow out and will cover up your section. Now if that happens, you've probably got about a 20-minute penalty because we'll have to take that wax off. So you'll be going through a little remedial class with me over there if that happens. And given that we don't have an abundance of time, let's not take that chance. So basically what we do is we have our piece of tissue on the slide, we take the pen, we just draw a circle around it. You don't want to be too close to the tissue, because obviously if the wax touches the tissue, the reagents can't bind. And of course we don't want to be so far away that that we're wasting reagents. So a good rule of thumb is if you think of the width of this, the line that comes out, you probably want to be about that far away from the edge of the tissue. If you like, you can do either technique to suit. So you can just draw a circle around the slide, or you can just do 2 lines above and below, if that's a little bit easier. But so historically, you'll try and draw a circle around just to minimise the usage of those reagents. Okay. Then once that's happened, we're going to put the slides into a wash buffer. So you'll see that you've got 2 Copland jars that are labelled wash 1 and wash 2. They're described in the notes here as wash 1 and wash 2, so make sure you follow those. Anytime we do a reagent incubation, what you'll do is you'll tip those out into the sink, refill it with fresh wash buffer, and then that'll be ready for the next step. The reagents are going to be handed out as we go, because obviously this being a sequential technique, if we put the wrong reagent on, the slides will absolutely fail. So you just got like a little weigh boat with the reagent in there. At the end of each step, we'll run around, we'll collect up the old ones and we'll replace it with the next one. And they should have some clear identification on those, and you just need to make sure when we put the antibody on, that's on the right slide. Okay. So I think now's probably a good time to go and grab your slides, come back to your bench, label them up, and then